Okay, welcome everybody to Anatomy and Physiology 2. The course code for this is Bio, BIOL 202. My name is Dr. Gamaro. This is a live, totally live lecture and lab in an accelerated course. So this is me, and I'm not saying welcome to A&P 1, that's a typo. It's welcome to A&P 2, but I want to switch over to hold on. Just switch over to stop sharing. There I am. All right. So me and the two buddies over here. Maybe you've seen these guys before. Maybe the insides of him. This guy has no guts, right? This one, you know what I'm saying. My name's Dr. Gamaro. A little bit about myself. I was born and raised in New Jersey. Some of you I've had before in A&P 1. So yeah, I was born and raised in New Jersey. I did my undergrad in Ohio University and majored in pre-med zoology. Then I went to medical school in the Caribbean island of Grenada. And what we do is the first 2 years of medical school is the book work, this kind of stuff that you're doing right now, where you're sitting down, taking notes with anatomy, physiology, microbiology, that kind of stuff. And then the last 2 years is where we go into the hospitals, and those are known as the clinical years, where we practice on patients with what we learned in the first 2 years. So I actually was able to bridge my two loves of medicine and traveling. So I actually did my clinical years in England, and I was doing that for a year and a half. Saw socialized medicine, realized it won't work in America, but that's another talk for another time. So I did a year and a half of clinicals over there. And then I did the rest of my 6 months or so of clinical stuff in New York and New Jersey. Then I entered the field of obstetrics and gynecology. I did that for a number of years, delivered 3,000 babies, lost track after that. And then I had to get some knee surgery. My mother had a stroke. She's fine now. She's a nutcase as usual, driving around and stuff. But at the time, we just didn't know, and I had to get some knee surgery. So I wanted to take care of those personal items. I could step back from the doctor realm, take care of these things. And as I was doing these personal things were changing in the medical world. Things that I didn't sign up for. What I signed up for was when I was practicing, I would spend some time with a patient, maybe 20 minutes or so, and get to ask them questions and examine them. And I would come up with a diagnosis, I would come up with a treatment and so forth. But it's changed. Some of you can relate to this. If you're if you have to see your doctor, you sign your name down, and then they call you by the name. They don't call, but my appointment was before hers, and they go by the way you come in. So I didn't understand that. So you have that, and then you have to sit in a large waiting room. They call your name, and then you go into a smaller waiting room. And then someone takes your blood pressure, and then they take the temperature and so forth. And that person leaves, and another person comes in, and asks you some questions. Maybe does an examination, and then that person leaves, and another person comes in, and once they ask you some questions, they're like, whoa, who are you? Well, I'm Dr. Smith. You're Dr. Smith, then who just examined me? Oh, that was the nurse physician, or the nurse practitioner, or that was the a physician assistant. So it's like you're in this assembly line, and it's not medicine that I'm upset about, it's the patient care. And I think that when you have so many people doing this, it's like playing that game telephone when you have a line of, let's say, 10 people, and you say the word and whisper in the ear, and you say octopus, and then by the time it gets the other one, they pass it along, whisper in each other's ear, and at the end of the line, they say umbrella. Like someplace it got mixed up over there. And when you have these people doing that, the examination and asking questions, and then the doctor is the one that is responsible. So now you're repeating all the kind of questions, and that sometimes can tick off a patient. I'm like, I just said that to the other person. Can I see my doctor kind of thing? So it's not, and then I could only spend like maybe 5, maybe 10 minutes with the patient. So anyway, I digress. Things have changed. Even if you get admitted to the hospital, the doctor, your doctor doesn't have privileges at the hospital. You now see a hospitalist who doesn't even know you. So things have changed. So anyway, enough of that, but I'll come back to it in a very fast second. So I said, what other things could I do? So another person told me, well, you can teach. And I'm like, teach? You mean colleges? And he said, yeah, see what it's like. So I tried it out. 15, 16, 17 years later, I'm still doing the same thing, and I'm loving it. The reason why, and going back to the thing, is I've worked with radiologists and pharmacists and nurse practitioners and the whole medical professional realm. I know the things that they need to know because I've worked with them. I've socialized with them in the cafeteria. We have barbecues, and we just talked. See where the areas were bad and things like that. Not that I could change anything, but I could see what was going on. Anyway, that's where the teaching for me is different, because I know the things that people need to know. I need to know a little bit about you, and then we'll talk about that in a second, but it helps me. If you're going for physical therapy, I know you need to know muscles and bones or whatever. But overall, you need to know about how things function, applying the material. So a lot of my questions are going to have that, being able to apply it, because when you get into nursing school or physical therapy school or wherever you're going to go, those are the questions you're going to get. And I've been following, especially the NCLEX, which is the nursing licensure exam, and I've been following it over 15 years. It's gotten different. It became different, evolved. Before, it was more like questions that they it was more of bedside, the dosage, like concrete kind of things. Now they're asking a lot of things about signs and symptoms of certain diseases. What would be likely it's a disease? So you got to be able to apply this stuff. So because of that, you'll see it, like I said, in my questions, and I'm going to teach it in a way that you're going to wire your brain. If it hasn't already been wired this way, it surely is going to be amplified, or I will wire it for you so that you will be prepared for all these nursing schools and physical therapy schools and medical schools, wherever you're going. So I want to prepare you for that. I want to be able to see if I could get you to do good test-taking strategies, good study skills, okay? So that's basically a little bit about myself. Oh, and the other thing, and I moved New Jersey to Massachusetts. My wife, I got married in 2016. My wife, it was easier for me to move, to relocate. So I moved up here 2016, and I've been teaching anatomy, physiology, biology, pathophysiology, microbiology, few different colleges. But I've been here at Massasoit since 2016. I'm actually teaching another class in New Jersey, all remote. Pandemic, when certain doors close, other doors open, and that's where I came back, and I'm doing a lot of remote teaching over there, anatomy, physiology. So that's a little bit about me. So let's go right into this thing, right? Let's go. I'm looking down. I'm sorry, but that's, the camera's there and there. So what I want you to do before we go any further is to print out the syllabus. It's 18 pages. The one in New Jersey that I'm doing, since it's all online, lab and lecture, it's 35 pages. There's just a lot of other things to be talking about with online. But yours is this. I chose to do this video lecture because on day number 1, I don't want to talk about the the syllabus. I usually spend a good hour and a half talking about it. And then we don't even get into much of the lecture. I want to do on day one, I'll answer questions about the syllabus. I'll say, anyone have any questions? So jot down your questions. But if there's no questions, or if there is questions, I'll talk, whatever, 10, 15, 20 minutes. If it's an hour, I'll talk for an hour. But I'd rather just make sure you watch this so I don't have to go through this whole thing again. And it'll just maximize our time together. So make sure you print this out and you can follow along with me, and we'll have loads of fun. All right. So let me switch back to the to my PowerPoint. Okay, there we go. And get rid of this thing. All right. So the first page and a half, you can read that on your own. It's a little introduction, a continuation of this course. It is going to be very, very fast. You all know that. You signed up for it. But keep in mind, one day is really 1 week. 1 week in our semester is really 1 month. So you have to think of that. It's not 5 months, it's 5 weeks. And you're getting the same amount of quizzes, the same amount of exams. Yeah, it's going to be hard on me too, grading these things very fast, but yeah, it's, you know what you're getting, okay? All right, so let's go into the, there we go. Okay, so the first thing is to do this entering survey questionnaire. It's found in Canvas. Canvas is the learning management system, the LMS that Massasoit has chosen. Fill it out. It's very fast to do. Do it online. I'll show you where it is. You just have to download it. Just type in your answers. Don't print it out. Just type in your answers. Save it. You got to save it under a different name. Use your first and last name, and then email it to me. Okay. The course description. This course is going to be part 2 of A&P, right? You learned all about that. I have to assume that you've mastered it, that you got at least 70%. You still know 70% of the material, hopefully more than that. But I don't have time to explain what proximal and distal is. I don't have time to explain the sympathetic nervous system is going to do this to the blood pressure. I have to assume that you've mastered that material and we just move forward. We don't have time to review that stuff. If you have to review it, there's tutoring that's going on, or you have the textbook from A&P 1, just review it yourself, okay? Or you could ask me. And as you've learned in A&P 1, it's really a manual about yourself. Always keep in mind that A&P is not a 15-week course, meaning that you need an A&P 1 and an A&P 2. Right? If you did it in the fall and spring, it'll be 15 weeks and 15 weeks. I should have changed this, but I didn't know when you took A&P 1, if it was 10 weeks or something like that. But just keep that in mind. As I told you, this is very, very condensed in 5 weeks. And if it's a hybrid, which it isn't, it has its own challenges. But we'll talk about that. Okay. So the course is a continuation of A&P 1. We're just going to dive right into the systems, endocrinology, hematology, cardiology, all the way down to reproductive system. If we have time to talk about, if we have like a half an hour left over for, because we finished hematology early, we'll go right into cardiology and do that for a half an hour because there's so much to talk about. There's, I must say, I'll tell you this, when students complete A&P 2, and I asked them, which one was harder, A&P 1 or A&P 2? All of them said A&P 2. However, I asked them, which one did they enjoy more? They would say A&P 2, because you finally get to see how everything is put together. It's more physiology in this course than there is like bones and names of muscles. That was more A&P 1. There was some physiology, the action potential, how muscles contract, but there wasn't much. You're going to see this is physiology. And in physiology, just it makes sense why this, if there's more force on the door from this side, it's going to push it that way. Like, it makes sense which way it's going to go. So, so students enjoy this more. Okay. So the course information, we're on page 4 now, skipping around a little bit, but 4. The prerequisite, as you know, is biological principles and A&P 1. Okay. The class dates go from May 30th to June 29th. All right. The day and time, Monday through Thursday. There's a few holidays. I'll explain that. But Monday through Thursday, 5:30 to 9 p.m. And it's going to be in room S, or the science building, 546. Okay. The laboratory times, well, it'll happen during lecture. Just come through there. It varies when we're going to do a little bit of lab. You know, we might have a half day of half the session of lab, half the session of lecture, that kind of thing. But it'll vary. Okay. Again, my name's Dr. Gamaro. Office hours, really any time after class is fine. You know, 9, if class ends at 9, I can stay to like 9:30, answer some questions. Contact information, Canvas is the best way, the really only way to get in touch with me. I check it 3 times a day. You guys should check it at least 2 times a day, maybe 10 o'clock in the morning and maybe 3 o'clock in the afternoon before class, kind of thing. Because I sometimes might give you some emails like 2 o'clock if I think of something. Anyway, so check that. Faculty offices, if for some reason you need to get to a message to me quicker than an email, you could always call the offices. They have my phone number. I do have my regular email. I don't want you to use the Yahoo one when you're doing this course. It's only like, you know, maybe a year later, 6 months later, you want to get a letter recommendation, you could always email me over there. I'll tell you that more at the end of the class or the end of the semester. The textbooks, yeah, whatever one you use for A&P in college, then yeah, just continue doing that. I'm not going to really use the book. Everything is in my PowerPoints and in my video lectures. All the information is just right there. I go over everything. But it's always good to have another resource if you need to solidify the material. You know, you're a little bit dodgy about a certain topic, then go to a textbook. You could just get the answers right there. The lab manual, again, I don't care which one you use. Maybe for the dissections, you know, if you have you should have the CAT edition. You might want to bring that in during those times. So that's a little bit about that. Okay.